Hello everyone, it's Dr. Hope and welcome to our Why Wednesdays. Today we're going to be talking about acne vulgaris. In other words, acne for short. So what is acne? So acne is a common skin disorder that's characterized by recurrent or persistent bumps in the skin of various sizes, and it could contain pus. It's usually found in the skin of the face, the neck, the trunk, whether in the front or the back, or it could be in the extremities, whether your upper extremities, it could be in your lower extremities. Depending on the size and the contents of these bumps, we call them either pustules or papules or nodules. So how does acne begin? Multiple factors play a part in the development of acne. I won't go into all of that in the video. Please click the link. It will get you to the blog where I explain a little bit more detail. But basically, acne occurs with the formation of comedones. So these comedones are skin-colored bumps, which are formed from excess sebum. Now, sebum is a lubricating oil that's secreted from your sebaceous gland underneath the skin. And that oil is naturally secreted to help lubricate your skin and your hair. So it travels along your hair follicles. It's secreted into your hair follicles. And when there is excess sebum in combination with inflammation in that unit of your hair follicle and your sebaceous gland, that results in a comedone being formed. Some people are familiar with what's commonly referred to as whiteheads. Those are closed comedones. And what's commonly referred to as blackheads, those are open comedones. Sometimes you might have bumps that are as big as 1 centimeter. Those are called nodules. Sometimes you might have smaller bumps that contain that they are inflamed to contain a little bit of pus and they're less than 5 millimeters. Those are called inflamed pustules. So it could range anywhere along, the spectrum of these bumps, depending on what's in it and how big it is and how it looks. So why is acne important for you? Now, these bumps, when they heal, they can cause scarring or hyperpigmentation of your skin. And this can be very distressing for patients. It can cause low self-esteem, it can cause anxiety, it can cause depression. And typically, acne is seen more frequently in teenagers and young adults. So that can be very impacting during those young formative years. You can still see it for the first time in adulthood, but it's usually more frequent in teenagers and young adults. So as you can understand, there is a great demand for effective anti-acne therapies. The primary mode of treating acne is you want to treat it early so that you reduce the complications like the scarring and the hyperpigmentation. And so if it's mild acne, then the primary mode of treatment is topical. That means you just apply it to your skin. And those could be any one or combination of topical retinoids, topical benzoyl peroxide, and or topical antibiotics. Now, if that has been tried and it isn't working and that mild acne is persisting, or if it's becoming more severe, so when you have moderate to severe acne, then that's where systemic therapy is needed. And this is the point where you would call your healthcare provider and let them know about what's going on. So for more information, click the link. It will take you to my blog. I'll give you a little bit more detailed information about acne. Otherwise, I will see you next time on our Why Wednesdays. And remember, you matter.